Hoosier nutrition. Internationally, about 2.4 billion people worldwide experience food insecurity. Factors like global conflict, inflation, and climate change have all continued to disrupt the food supply chains and increase prices. Across the United States, 47 million Americans experience food insecurity. The USDA reports that 12.8% of U.S. households were food insecure in 2023. Minority and low income families are disproportionately affected, especially Black and Hispanic households. Here in Indiana, our state ranks 26th in the nation for food insecurity. In Marion County, nearly 1 in 5 households struggle with food insecurity. Many areas in Indiana lack full-service grocery stores and depend instead on corner stores or gas stations for food options. What's even worse is 56% of Hoosiers who are food insecure make too much money to qualify for food assistance programs, yet they still don't earn enough money to provide healthy food consistently for their families. In Marion County specifically, access to affordable groceries are very limited. Many neighborhoods are classified as food deserts. This means residents must travel long distances to find fresh food and other healthy foods. This lack of access leads to poor nutrition, obesity, diabetes, and other chronic diseases. These trends show that food insecurity is not only persistent but also systemic, requiring coordinated policy and community level action. Our key stakeholders include healthcare providers who have seen poor nutrition effects firsthand, local food pantries and food banks, community organizations and faith-based groups that are able to distribute meals, and state and local government agencies that can influence policy. The demographics of the people who are most affected are low-income families and adults, especially those where the family members are working multiple jobs, living paycheck to paycheck, and facing barriers when it comes to transportation. Cultural and psychosocial factors also play a role. Health literacy gaps means that people may not fully understand nutritional information or available programs. There's also stigma around using food assistance, which might make families not want to join. Cultural food preferences also make eating healthy harder when traditional foods aren't affordable or accessible. There are existing public health preventions. Several programs have been addressing the issues and have had positive results. SNAP and WIC are critical, and they provide a great amount of support for families in need. However, they still leave out many families who earn just above the eligibility cutoff. The Indie Hunger Network is another great organization which coordinates food distributions throughout central Indiana, as well as provides cooking classes for teens. Health food access program like mobile markets and grocery pop-ups that bring produce directly to neighborhoods have also been shown to work. However, despite all these efforts and public health interventions that are already in place, with inconsistent funding, there is a lack of long-term sustainable change. I think this program would work if we are able to provide grants for groceries and mobile food trucks in food deserts, if we're able to expand SNAP eligibility and benefits for all families, and integrate nutrition education into communities through the local healthcare workers. Programs like this have already shown to be successful. There are 2 programs in both Michigan and Ohio that have had similar initiatives and were able to reduce food insecurity by 15 to 20%. For us to be able to lead effectively, we must raise awareness of this and educate, build trust, advocate for policy change, address systemic barriers, empower our partners, and try to understand different perspectives. To measure the success, we can use pre and post surveys, gather community feedback, and review timelines. In conclusion, addressing food insecurity in Indiana is more than just feeding people. This is about bringing communities together, reducing health disparities, and building a sustainable food system. Infographic.